Could be wrong now, but I don't think so. There's a jungle out there. People think it's crazy.
Sitting throwing rocks across the pavement, hoping it will cave in and swallow me whole. Wondering why my mind keeps on spinning. This isn't how living to me was. I don't know what else there is to say. I'm doing my best not to run away. Sitting throwing rocks across the pavement, hoping it'll cave in and swallow me whole. Wondering how the world keeps on spinning, kinda scared of living when it unfolds. Hard to see the light when everything is dark and waiting for the clear. Thankful I'm alive, but terrified of dying. But hey, I'm still here. Is it bad? Sometimes I like it when I lose control. There's something in it that's so beautiful. Listen, I can see the light, but I can also see the bones decay. I don't know what else there is to say. I'm doing my best not to run away.
Okay, everyone, we're about to begin, and it's always a pleasure when I get a chance to interact with, speak to our beloved patients, and to be able to share insights about health. Now, we are in a very interesting time, so I want you to feel free to ask your questions, and as you ask these questions, we will be able to hopefully there seems to be an issue. Alright, sorry, there was an issue with the quality of the stream. Hopefully it improves as we go along. But if you have not already done so, I'm going to ask that you go ahead and indicate your name in the chat, so I will be able to have this as our official register for the class. And I look forward to being able to interact with you all today. It is indeed a pleasure always to be able to have this time. Let me just say hi to a few people. Hi Kanisha, see that you're here. And Jerome, you as well. I look forward to, spending time with you guys. So you might want to just grab for yourselves a notepad or a pencil or a pen or something that you can scribble down some notes, because invariably when we go over these classes there are some important pieces of information that we will share, and as we share them, usually people are blessed. Usually people get something that they can take back home with them. So yeah, I invite you to just grab a sheet of paper and we shall begin. Now, my question, are you able to hear my voice okay above the sound of the music, or is the music too loud? Let me pull it back a little bit. Does that sound okay? Let me know. Let me know. So I just wait for the response in the chat. All right, cool. Perfect. All right, thanks, Tanya. So let us begin. I'm excited. I hope you are too. And hey, I need a life, because this is how I get my enjoyment in at the end of the day. So I guess I need some help. Anyhow, good evening, everyone. We're going to be discussing our topic, the 7 keys to getting and staying well. And so I'm going to bring that up here real quick. The 7 keys to getting and staying well. Now, this is a PowerPoint presentation that I've done a long time now, and what I've found is that it really does help put things into perspective for persons. Now, I know people will have a lot of questions, and depending on how the questions go will determine whether if you're not hearing, I'm going to ask that you try to check if your speaker is on, or the microphone is on, or check if you have volume enabled on the thing. Kenisha, can everyone else hear me okay? Just want to make sure that everyone is hearing me fine before we move forward. Yeah, good. Okay, cool. Perfect. All right, Susie Q, we see you. All right, so here we go, right? The 7 keys to getting and staying well. Yes, as I indicated, if it is, or if it turns out that the way that the questions go tonight, and I'll try my best to answer reasonably any question that's asked, but I have to be cautious because, as soon as you mention certain topics, people get flagged, and I don't want my page to be taken down. So I'll have to exercise some wisdom when I answer certain questions. So if you have any questions, feel free to ask. And enough said. All right, so let us begin. Okay, let me just set something up here. All right, so here we go. There is a handout that goes along with the lecture. I do not have it in a way that you guys can download it. I'll figure out how to just attach it when I'm doing the stream, so that way you can have access to it, but there is no way of filling it out online. You'd have to download and print it beforehand. Maybe I don't know, maybe I'll hand it out to each person before, when you guys are in the office. I don't know, we'll figure it out. But as it is, we have a handout form because I expect participation. I expect persons to want to take notes and want to follow along. So here we begin. The topic is 7 keys to getting and staying well, and the first key is understanding the difference between sick care and health care. Sick care versus health care. And most persons have a very poor understanding of what it takes to be healthy. That's the first thing. We have a poor understanding of what it takes to be healthy. The second thing is that most persons have a lack of will to do the things that are required to be healthy. And with that combination, it makes it almost impossible for most persons to achieve a very high state of health. Most people either don't know, they're ignorant, or they might know but they lack the will. So my hope is that through this session tonight, it will give you more information so you will know more about what it requires or how to have a mindset towards wellness. And it will also give you a little bit more of a motivation to do the things that are required to be healthy. Now, the first thing we have to realize, as we just some basic understanding of what I mean by certain terms. When I say sick care, I am referring to the healthcare system as it is currently, but not in a derogatory way. I am speaking of the healthcare system as a sick care system because the focus of that system is on those who are sick. It's not focused on the healthy person, but it's focused on the sick person. So in other words, a healthy person does not usually go to a healthcare facility for services. The primary person who goes to a healthcare facility for services are those who are sick. And so you'll find, if you look at the total makeup of the persons within a healthcare facility, office, a doctor's office, a hospital, almost 100% of those people have a disease or have something that's wrong with them at the time that they go. Very few people will go when everything is going well. So as a consequence of that, you find that the system is geared at treating those who have an illness. So it is caring for the sick. And so when I say sick care, we mean the system that cares for the sick. That should be contrasted with true health care, which is focused not on caring for the sick, but on optimizing health. And I'm going to try to talk about those two things shortly. But the problem with sick care is that it's a reactive system. You have to wait until something goes wrong first, and then you try to do something to intervene. So it's a reactive system. If you want true health care, you have to have a different approach. True health care is proactive. And by proactive, we mean that you do things in anticipation of and to prevent a negative consequence from occurring. And so you set the stage first so that when something comes your way, you are either already prepared or it prevents something from coming on in the first place. Case in point, this situation that's going on, Many people believe that the only solution, I don't want to say solution, but the only preventative method or approach to getting this illness, and I hope you understand what I mean. I'm not going to call its name, but the only way of preventing getting this illness is by taking some kind of an injection. Again, not calling any names. But the problem with an injection is that there are certain unknowns, and so some people are uncomfortable. So we understand that. But what many people don't know or don't realize is that that's not the only way to prevent or lower your chance of catching something or getting something. Do you know one very easy way that almost every single person can do free of cost to considerably reduce their chance of getting this illness? And when I say it, you might not appreciate how important it is, and that's because you don't hear it broadcast about by our ministry. But the number one thing that we can do to prevent ourselves from getting this particular illness or any other respiratory tract infection is vitamin D. Good old vitamin D that God has made, vitamin D that comes from sunlight. If you have enough vitamin D in your system, your chance of catching the disease, catching it, not getting sick, catching it, goes way down. Not only catching it, but also if you were to catch it, your chance of getting very sick goes way down. And even if you get very sick, your chance of dying goes way down. And there are so many studies that confirm this exact point. It is an embarrassment, and it calls into question the motive behind the system that prevents persons from hearing this information. And so it's really shocking to me, and every time I hear it and every time I see what's going on, I shake my head, because I see a lot of people who are dying unnecessarily, and a lot of people who could have been saved had they just done a few things differently at a different time in the course of the illness. But we see too many people dying. I've lost members of my practice. I've lost family members of our practice. I don't think I've lost any family members yet, because typically when a family member of mine gets it, and I have family members who get it, we usually tell them simple things that they can do and they recover. So, and these are things that information that we also extend to any of our practice members. Anyone who is either a patient, a family member of a patient, you can always just call the office as soon as you have any symptoms of the illness. Call the office and let us know that you think you might have it, and you would like for us to send you our home treatment protocol that you can use at home. It's just natural herbs and vitamins and minerals and different things that you can do and do easily at home to prevent yourself from getting sick. So that's proactive. So if this is if this is of interest to anyone, you can just let me know, right? The only thing is that I'm not going to send it to you in anticipation. I'm only going to send it after somebody has already gotten sick, because people sometimes I find that a lot of persons don't act when you give them things early. So when there is an issue, that's when they'll take action, and I want them to take action. So as soon as there's an issue, you call us and we'll get this information out to you as soon as possible. But True Healthcare is proactive, meaning that we do things to prevent illness. Now, we are in a healthcare crisis because we're spending more money on health measures, but yet still we are getting sicker as a people. Excuse me, sorry. I'm not sure if you realize that we are very sick. If you did not realize that we're very sick, look at the statistics. How many people in this country have heart disease? How many people in this country, or any country for that matter, the majority of the countries, have high cholesterol? How many people have high blood pressure? How many people have diabetes? How many people have had strokes? How many people have a blood clotting issue? There are many people with different health issues. But we're spending so much money on medications and surgeries, and we're getting sicker. So clearly we're not spending our monies in the right way. If I were investing in a stock or any bonds or anything at all, and as I'm putting in my money, the thing is devaluing, then at some point I'm going to have to stop putting in my money because I don't want to just be throwing money away. So that's kind of how it is. We're investing in health by throwing a lot of money at the health industry that exists, and we're not seeing the positive outcomes. But the reason we're not seeing the positive outcomes is because the health industry as it exists is not catering to optimizing people's health, but it's catering to trying to get sick people well. So it's treating sick people. And there is value in that, don't get me wrong. But when that becomes your focus, then you will always have an issue with shortage of spaces in hospitals, because you will always have sick people. Our focus really is how do we reduce the number of sick people in our world. This is something that anybody who wants the world population to get smaller will have a challenge with, because this invariably will cause the population of the world to increase if we have more healthy people. So there you have it. So let's move forward, right? There are two ways that we can think when it comes to health. The first way is the way that we call the illness care approach, which is based on the sick care system, which we learned that approach from Big Pharma. And when I say Big Pharma, and whenever you hear the term Big Pharma, Pharma, comes from the same word that pharmacy comes from, but it's the pharmaceutical industry. Big Pharma is the overall term given to the pharmaceutical industry, especially the major players of the pharmaceutical industry. These are the drug companies. That's whenever you hear that term Big Pharma, they're talking about the drug companies. Now, the problem with Big Pharma is that they teach us how to depend on their products. So they teach us to think in a particular way that gets us focused on always asking the question, what can I take in order to feel better? See, when you get people conditioned in the way of asking that particular question, then you will always get them in a mindset of medication. If you want wellness, if you want to be truly healthy, you can't simply be asking what to take to feel better, because here's the reality. There are many medications on the market that can change the way you feel without changing your health status at all. In other words, you're just as unhealthy as before, but you might feel a lot better, or even a little better. And I have a problem with that, because there are a lot of people who end up delaying appropriate treatments because they're taking something that makes them feel better. So in the short term, they think they're doing better, but in fact, they're not. So we want people to change from having an illness care mentality to a wellness care mentality. And so flipping the question in a different way, instead of wanting to feel better, if we were to ask ourselves, what do I need to do in order to get better? That question is a much better question to ask. And that question will enable us to be able to have a better chance of achieving better health. So I hope that makes sense. So rather than saying, what do I take to feel better? You ask, what do I need to do in order to get better? Because getting better is way more valuable to us than simply just feeling better. How about this? Get well. I don't know if you've ever had somebody sick in a hospital, and you might call them and say, you know what? I want you to get well soon, okay? Get well soon. When people say get well soon, what they're doing is they're hoping or wishing that the person achieves a state of wellness as soon as possible without necessarily doing anything. It's as if we're hoping that wellness will just fall into their laps. But that's not how wellness is. Wellness is not a destination that you get to or you arrive at. Wellness is the journey itself. We don't say, am I well? We say, am I trending in the direction of wellness? Am I getting toward a higher state of health? Or am I moving toward death and disease? Those are really what's at stake. All right. So it's not a matter of simply saying, what can I do to get well, or how quickly I can get well. Is what do I need to do in order to stay well? Because staying well means you have to be doing something ongoingly. So once you say, or you ask the question, what can I do to stay well? It automatically puts you in the mindset that whatever it is that you're going to do, you're going to have to stick with it. You're going to just have to keep going at it. So I've been a vegan now for, wow, I think I became a vegan in November. I have to stop and think about it. I think it was November 2019. Or it might have been November 2020. I'm not sure. This situation has just turned my time perception upside down. But I think it might be 2019 is when I gave up fish. And I gave up all other meats in July of 2013. So I was a pescatarian for several years, and then I fully gave up all meats, all animal products, and I'm now a vegan, full vegetarian. I eat no animal products, no dairy, no eggs, no no chicken. Some people don't realize that chicken is not. I wouldn't even go down that road. But no animal products. And I have to say that things are a lot different. I don't know if you can tell how nice my skin looks. Yeah. Or my hair. I have a lot of grays now. See some grays. But yeah, things are going very well. And a lot of things that were actually messing up in my health before are doing a lot better. And I've lost a lot of weight. I got up to as much as 195 pounds. I got up to as much as 195 pounds. Yeah, I think it was November 2020. I got up to as much as 195 pounds just before COVID hit. And I'm down to 175 now, so about 20 pounds. And I actually kept losing weight, and I had to make some changes in my supplement program to prevent myself from losing even more weight. So, things are going very well, I think, as far as my health is concerned, right? So staying well, that's the key. Here's the other one, staying alive. You know what? A lot of persons look at how healthy they are based on how long they live. Or they see somebody in their 80s or 90s and say that person must be very healthy because they're living a long time. There are a lot of unhealthy people that live a long time. There are many unhealthy people that live a long time. It's just that they're not unhealthy enough for the illness to kill them. And there are a lot of healthy people that don't live very long. So when we talk about having a wellness mentality, we're not talking about how long people stay alive, because there are certain technologies now, ventilators, life support machines that can keep you breathing, keep your body animated, so you're still having brain activity, even if you have no other function. You might be in a coma, you might not have any ability to do anything or interact with anyone, but yet still they can keep you alive. So how long you live is not a function of how healthy you are. How well you live is more the function. So rather than thinking staying alive, think feel alive. You want to be able to feel fully alive. And it's when you feel alive that your quality of life is at its highest. So this is what I encourage persons to do. figure out what you need to do in order to feel alive, not simply stay alive. So if you look carefully at what we see here, there's a subtle change in the order according to the illness care model and according to the wellness care model. In the illness care, it is feel, get, stay, and in the wellness care, it is get, stay, feel. A very subtle shift can make all the difference. The truth about pain. Now, here's a question for you guys. Is pain a good thing or a bad thing? Who can say, is pain a good thing or a bad thing? And I'll give you a second to just answer it in the comments below. Is pain a good thing or a bad thing? The answer is pain, wait for it, can be a little of both. But the point is not whether pain is good or bad. That's not the important thing about pain. The important thing about pain is that it has a function. Pain has a purpose. It has a role in our lives. And that role is to alert us that something has changed and needs our attention. So something has gone awry. So we need to attend to it. But here's the problem. Not every time something goes wrong is there any pain to warn us. And I say it one more time. Not every time something goes wrong will there be pain to warn us. Case in point, cancer. There are a lot of people who have cancer and have cancer for several years with no pain whatsoever. So cancer in and of itself does not necessarily come with pain, and so pain is not a good warning system in that regard. In fact, pain is actually not a very good warning system for many diseases. We know of hypertension or high blood pressure. There's a reason they call that the silent killer, because it comes without any pain associated with it usually. So there you have it. Now, the problem is that you can't trust pain, and having good health doesn't mean, or feeling good doesn't mean that you're having good health. So they're not the same. Feeling good and good health are not the same things. And so when you have somebody who is bent set on just wanting to feel good, they're going to set themselves up for failure, right? They're setting themselves up for a problem, because feeling good is not, the pursuit of pleasure and the avoidance of pain is what animals do. Human beings have a choice, a will that can override that basic instinct. We also have that desire, but we have the ability to override that desire. Animals do not. And that's kind of what makes human beings unique. So despite great pain or suffering, we can do something that can cause us more pain, but we do it for some other good, right? And that's the human reality. For example, a lot of persons have convinced themselves that they're going to do things to help somebody else that puts them at a deficit. I mean, why would we want to give blood to somebody else? There's nothing inherently pleasant about giving blood, but we do this because it helps somebody else, right? And so we are higher animals for that reason, and so we don't live based on the pursuit of pleasure and avoidance of pain. And feeling good doesn't mean you have good health. If you want to know if your health is good, you have to check how everything is functioning. Good function means good health. So when I say good function, we're not just talking about how your body works on the outside. We're talking about all the organ systems of the body. If it's functioning properly, if the different systems work properly, then you have good health, or you have a good chance. So we need to start trusting how we're functioning, not how we're feeling. And so as we go to the systems of the body, there are different systems of the body, and we'll go through them here together. You have the immune system, the digestive system, cardiovascular system, integumentary system, and for those who do not know what the integumentary system is, those are your skin coverings. Respiratory system, endocrine system, reproductive system, excretory system, musculoskeletal, and the nervous system. These are the different systems of the body. And all these systems have value. All these systems are important systems, and it doesn't matter any system at all that stops working properly, any system that's no longer healthy, it means automatically that you are not healthy. If your heart isn't healthy, you're not healthy. If your respiratory system isn't healthy, you're not healthy. If your digestive system isn't healthy, you're not healthy. Any system that's not healthy means that you have a disease, and any disease means that you're not healthy. So this is the reality. But did you know that of all of these systems that we have listed here, one of them is considered to be the master control system? And the reason it's considered to be the master control system is because it controls all other systems of the body. It regulates the function of all the other systems of the body. And so when we look at it, which system is this? The nervous system. And when we look at the nervous system, what's interesting about the nervous system is that it has different branches. It has the brain at the top, which is like the powerhouse of the nervous system. Then it has the spinal cord, which runs down through the middle of the spine. Then it has all the nerves these nerves leave the spine, and they go to the different organs and every part and function of the body. Your nerves control how your body works. And the reason this is important is because your nerves respond to your environment. It's the first thing that responds to your environment. If you see something that is dangerous, it's your nerves that allow you to see it. If you hear something, it's nerves that allow you to hear. If you feel something, it's your nerves that allow you to feel. We experience our world through our nervous system. And if our nervous system is not working properly, then many other systems will fall apart. Please understand, you cannot have a healthy body without every system working well. And the one system that governs the function of all the other systems is the nervous system. And so we're going to look at it because the nervous system, for that reason, is considered to be the master control system. A misalignment is known as a vertebral subluxation, and vertebral subluxations cause nervous system dysfunction. Vertebral subluxations cause nervous system dysfunction. The term vertebral subluxation means misalignment of the spine, and what it looks like, if you look at this diagram right here, you'll see that the middle bone, I wish I could point to it using my fingers, but that middle bone yes, that middle bone is very important. Now, if you notice, it's pushed backwards a little bit, and there are openings where the nerves would exit normally in the back, and because the bone is pushed out of alignment, it closes off the space where the nerve would exit, and so the nerve is now being impinged or interfered with. Whatever this nerve controls is no longer going to be working properly as well. I hope you see that. Now, here's what people don't understand. These nerves, as we showed you before, they control organs and functions. I'm going to try to see if I can just backpedal a little bit to our previous slide. I'm going to take off myself here so I can show you what's happening. Now, as you look at the nervous system, you have the brain here. The spinal cord is what goes down through the middle of the spine here. And then these yellow and blue lines are all nerves. And if you look carefully, you will notice that all the nerves control an organ. So if you look at the heart, for example, right here in the middle, this nerve that is yellow and this nerve that is blue both go to the heart. In fact, every single nerve or every single organ has a nerve that comes from each of these two divisions. The yellow division we call the sympathetic or the fight or flight mode, and the blue division is what we call the rest and digest mode. It's the recovery mode. And so if you're stressed, your body goes into recovery mode. Body will go into stress mode, which will cause you to want to have your not want to, but your heart rate in that state will go up. Your breathing will speed up and get deeper and more forceful. Whereas when you're resting and relaxed, your heart rate slows down and your breathing becomes more shallow. So these are very important things to understand about how nerves control our functions, and it's the nerves that tell the heart what to do. If it is that you see a gunman and then your heart races, it's because your eyes saw it, your nerves transmitted the signal to your brain and then from the brain back to the heart to tell the heart to speed up, because it's a part of your defense mechanism. And when your heart speeds up, you move faster, you get more blood to your muscles because you might have to try to escape. So this is important, all right? So I just wanted to point that out really quickly. All right. So let us continue, shall we? Stress is what causes our bodies to break down. Many people don't understand or appreciate the role that stress plays in our lives. And I'm going to say some things here that hopefully will wake up some of you. In a good way, right? Now, when you look at stress, there are 3 dimensions of stress: physical stress, biochemical stress, and psychological stress. These 3 types of stressors are the types that we are exposed to that will impact our ability to remain healthy. For the physical, we're talking about a car accident, a fall, something tangible, something physical that happens to our bodies. By biochemical, we mean something that is a chemical that gets inserted into our bodies that can change our biology or the way our bodies work. Do you know of any chemicals that we can put into our bodies that can change the way our bodies work? We have perfumes, we have lotions, we have hairsprays. All of these things that you're putting on your skin, do you not know that it gets absorbed into your skin? So here's a rule of thumb. Do not put anything on your skin that you're not willing to put in your mouth. Now, I know that's not easy for most people, but what that basically is saying is that because things get transported across your skin surface, don't just carelessly and willy-nilly put anything into your bodies, right? We have to be very strategic about what enters our bodies, because our bodies, that's the only thing we have responsibility for, that we are guaranteed that we have responsibility, or well, up until recently, we had a guarantee that we will always have responsibility for our own bodies. But there are people who are bent on taking our freedoms away from us and our ability to have full autonomy of any decision that's made as it relates to our bodies. Now, I'm going to skip this particular slide, the general adaptive potential, but just to say of it that our general adaptive potential is our ability to adapt to our environmental stresses. If we have a low resistance, then the external stresses can overpower us and make us more vulnerable to getting sick. If we have high resistance, then our external stresses will not be able to overcome us so easily, and we are less likely to get sick. Chiropractic is a tool that can improve our general adaptive potential. The wider our gap is the healthier we are. Now, our job as chiropractors is to be able to identify subluxations of the spine wherever and whenever they happen. There are a couple of tools that we see here that can help us to identify subluxations in the body, which is what we invest in, these technologies right here. So we have a rolling thermal scanner on the left, and we have a surface EMG device on the right, and they both tell us what's happening with the spine. So the question might be asked, what kind of doctor is a chiropractor? A chiropractor, or doctor of chiropractic, is a specialized physician in the healthcare world that does not use medications. We do not use surgeries to try to improve the health effects of our population. And that is important. All right? That's what we do. Now, we achieve our objective as chiropractors by using the spine as our tool to influence the function of the brain. And so if we are using the spine as our tool to influence the function of the brain, then there must be a way of showing a change in the brain based on something that we did to the spine. And yes, this study that I have here on the screen is a fine example of that. So I'm going to try to bring this up for you so you can see. So before and after an adjustment, right? Before on the left and after on the right. If you notice, there are several areas of light all over this brain on the left, and the areas of light represents area of brain activity. The higher the activity of the brain is, the more areas that the brain is incorporating or using in order to do whatever task it's trying to do. On the right hand side is an example of a lady who, after she was asked to wiggle her left ankle and they did the image, she was asked to repeat the task after being adjusted, and what we saw was an area with far fewer lights associated, which means that there was a lot less brain involvement in the movement, which means that the movement was more efficient, or the brain was operating more efficiently. So that's an important distinction. All right. All right. Chiropractors, ladies and gentlemen, are not bone doctors. If you see down here, we are nervous system doctors. It might be true that we typically will realign the bones of the spine, or we will use the bone as our contact point, but it's not the bones that we're treating. So please do not think of us as bone doctors. What we do more impacts the nervous system, so think of us as nervous system doctors, because that's what chiropractors do. Our work impacts the nervous system far more than it will ever impact the bone itself. Alright, I'm a chiropractic neurologist, which means that I have specialized training to do different things than what your regular chiropractor will do. Your regular chiropractor, they're all trained to realign the spine, and that's primarily what we all do. We all realign the spine. because that's our bread and butter. That's what we are trained to do. But a chiropractic neurologist also has specialized training, or we are given specialized instruction on how to retrain the brain itself. And this is important because retraining the brain is key if we want to improve people's outcomes. These are some conditions that I have personally treated. Speaking delays, walking issues, bedwetting, dyslexia, difficulty swallowing, ADD, OCD, Tourette syndrome, different things. And these are things that we all treat. Alright, almost finished now. Our vision at Gardner Chiropractic and Neurology Limited is to identify subluxations wherever and whenever they happen, to provide a program of care that will help persons to achieve or maintain a higher state of health and wellness, and to educate our community. And when I say our community, I mean not just those in Jamaica or not just those in the immediate vicinity with me, but from all over the world. And this strategy using YouTube also helps us to achieve that. Now we have to take responsibility for our health and well-being. Very important that we do so. Take responsibility for your health and well-being. This is key, because if you don't take responsibility, you're going to be in trouble, right? Or the ones who depend on you will be in trouble. If you visit our Facebook or our YouTube channel page, you will see we have an album for our testimonials. If you look into that album, you see all the videos that pertain to testimonials from different people at different times. Now, and if you have not yet done so, I'm going to ask one more time. Please put your names in the chat, because the names are going to make a difference for how the next part of what we're going to say will go. So please put your names in the chat. Now, for those of you who decide to make an appointment with us tonight, and the appointment is not for treatment, the appointment is for an examination. You do not become my patient per se upon just receiving the examination. I have to also see that it's a case that we can accept, or a case that we can help with. And if it's a case that we can help with, then I'll explain to you what we need to do to try to address it. And if we can successfully do it, or if you agree to those terms, then that's when the doctor-patient relationship is established. So I'm not inviting you to become my patient. I'm inviting you to call and arrange for an examination. This examination is going to allow me to see what's happening along your spine or with your spine, so that we can make appropriate choices or interventions as it relates to good health. All right. So 40% discount will be offered to any new patient or any new person that wants to make an appointment to see us. That 40% discount is applied to your new patient examination fees. Not subsequent fees, just your new patient examination. So bear that in mind, right? And for our existing patients, you will get a lot more. You will get that a 20% discount off the update exam, and the update exam actually is almost the same cost as the new patient exam. Your update exam is 20% discount off that, just for being a part of this class. And all you have to do, and I'll explain what to do in a second, there's also a referral discount of 20% if you refer somebody to our office. So if you refer somebody to our office and when they come in, that 20% is automatically added to your account. So that's very important. The last thing is you'll get a 10% discount off the entire next phase of care if you are an existing patient. So by listening to this presentation, you'll get a few incentives. All right, so bear that in mind. If you know anybody who's that you wanted to invite to come in and they have not yet come in, then you can ask them to join us next month on the third Thursday of October, which is I think the 21st of October, because that will give us more information. Like this, that you can utilize to guide them, right? So if somebody you know is interested, point them toward the next class. It's on the 21st of October. And in that next class, we're going to be discussing similar type things, probably picking up where I left off on certain things. Who knows? We're going to try to keep it light. But you get a 10% discount off that next phase of care. The next phase of care is 12 visits long. Usually it's about 12 visits is a phase of care. So if you get 10% off that entire phase, it's a lot more money that you're going to be saving than the 20% off the new patient exam or the update exam. So it is very important that we do these things because, you know, when times are hard, we want to be able to offer people a reasonable way of saving money, and we can justify this discount because by listening to this class, I am educating you, and the more information that you have, the more educated you are, is the better choices that you can make. And usually people who make better choices are better patients. They usually refer the most and they usually take care of their bodies the most. So very important. All right, so these are the things. So I hope you learned something today. There are different ways of interacting with us. You can interact with us via our webpage at gcnjamaica.com. You can interact with us on Facebook at GCN or on YouTube by going to YouTube and typing in Gardner Chiropractic, one word, Gardner Chiropractic. Or you can go back to Facebook and join us on our Back to Health Talk Show page. Like that page, just go and type in Back to Health Talk Show. When you like that page, it will allow us to be able to reach more people. So please like that page. So where do we go from here? Where do we go from here? There are a lot of people who are sick in our world, and because they don't know what to do, they make poor choices, or they're forced into making a bad decision for their health. There are also persons who they might understand what to do or basics, but they're lazy or it's difficult to do. Shouldn't call it lazy, because some people, it's not lazy that they're lazy, they just have a difficult time for whatever reason. So we want people to understand and appreciate health as much as possible. The more you understand and appreciate about health, is a better command you will be able to have of your own health and make wiser choices. Yeah. So that's it for me. I hope you learned a lot tonight. I'm going to stick around and just answer a couple questions for a few minutes, and then after doing that, I'm going to sign off. So I do hope that it is of benefit to you. So I'll sign off for those who are leaving us, so we'll have a wonderful night. Oh, I didn't put up the website that you can use to get through to us. Hold on, I'm gonna get to that website. The website is appointments@gcnjamaica.com. If you just type in appointments@gcnjamaica.com, just tell them that you listen to the show online, and we will check to see if your name is listed in the chat section. And if it is listed in the chat section, then we can go ahead and offer you the discount. If it's not in the chat section, you know, not gonna work. So please make sure that you write down your name in the chat if you want to take advantage of this offer. Well, that's it for me. Have a wonderful night. May God bless and keep you. Any questions for anyone, feel free to ask now. I'm gonna stick around for a short while and then answer them. And I promise I'm gonna turn up the music a little bit more to answer these questions. So any questions from anyone, just type it into the chat. Well, since no one is asking any questions, I think it's my cue to... Alright. Is it... I'm just gonna ask Jerome, is it that you would like appointment for Nikki? Okay, so Ralph is asking if his son will get the discount for him being a part of this presentation, and the answer is yes. The answer is yes, your son will get that discount. Your son will get that discount. And yes, Jerome, your wife will get the discount as well. See how easy that was? think that's it. Welcome, well done.
When I'm lonely in the dark, I know you are with me. Yeah. Don't you see that I need you so much? Don't you see that I love you so much? Oh na 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 na, oh na 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 na, darling, I need you.
All right.